Hi, this is Diane again. Welcome to Many Eyes of Addiction. I am going to share with you today a video put out by zubsolv. Their representative in our area authorized me to share a couple of different videos with you. One is a patient that's talking about his treatment and his addiction, and one is just general information about how the medications work and why they work. And I really feel that they'd be informative for you. Hopefully it will help you to understand addiction and addiction medicine, and how it works, how it helps everyone, and the fact that there are many, many different ways of getting through the addiction process and becoming well. So without any further ado, I'm going to share the video of the generalized information, and next week I'll share the video with the patient talking about. So again, without further ado, I'll share with you this video. Thank you.
Opioid dependence, or opioid addiction, is a chronic disease like heart disease or diabetes. It is a disease that can develop when either legitimate use of or misuse of opioids makes changes to the brain, so that the brain starts to think it needs opioids to function normally. Opioid dependence has nothing to do with willpower or being a good, bad, or weak person. Anyone struggling with opioids should seek treatment from a healthcare professional. Your healthcare provider may recommend medication-assisted treatment, also referred to as MAT. The goal of MAT is to provide medication to overcome the misuse of an opioid. MAT helps relieve withdrawal symptoms and cravings from the opioids on which you are dependent. Counseling and other support are recommended as part of your treatment. Congratulations on taking this step in your recovery process. If you're wondering, here's what comes next. When you first meet with your healthcare provider, you may be asked about your drug history. It is important to be truthful and to provide honest answers. Depending on when you last took an opioid, your healthcare provider will recommend starting treatment either immediately or at a later date. So again, you need to be honest. If you took an opioid too close to your visit and do not tell your healthcare provider, this may impact the symptoms as you start your treatment process. You may experience more severe withdrawal symptoms when your treatment process begins. It is also important you provide accurate feedback while you undergo treatment. Let your healthcare provider know if you feel any withdrawal symptoms. Your input is critical to ensure you are receiving the correct dosage you need for effective treatment. Zubsolv is a prescription medicine used to treat adults addicted to opioid drugs, either prescription or illegal, as a part of a complete treatment program, including counseling and behavioral therapy. Do not take Zubsolv if you are allergic to buprenorphine or naloxone, as serious negative side effects, including anaphylactic shock, have been reported. You may be prescribed Zubsolv for your opioid dependence. Zubsolv is a medicine that contains both buprenorphine and naloxone, and it is taken by placing a tablet under the tongue to dissolve. Zubsolv treats opioid dependence, prescription or illegal. Zubsolv is not right for everyone. Your healthcare provider will determine if Zubsolv is right for you. Patients dependent on heroin or other short-acting opioids may start treatment with either Zubsolv or buprenorphine alone. Your first dose of Zubsolv should be taken only when your healthcare provider sees certain signs of opioid withdrawal. To avoid severe opioid withdrawal symptoms, it should not be taken less than 6 hours after your last use of opioids. Patients dependent on methadone or long-acting opioids should not use Zubsolv to start their opioid dependence treatment. Now I will show you how to open the Zubsolv package and how to properly take this medication if it has been prescribed Zubsolv is available in 6 dosage strengths, which enables your healthcare provider to adjust your dose as needed. Your healthcare provider gave you a prescription for the strength you need. It is important to take Zubsolv exactly as directed by your healthcare provider, because they may change your dose after seeing how the prescribed dose affects you. Do not change your dose unless your healthcare provider tells you to do so. Zubsolv is a controlled substance, C3, because it contains buprenorphine. Keep your Zubsolv in a safe place to protect it from theft. Never give your Zubsolv to anyone else. It can cause death or harm them. Selling or giving away this medicine is against the law. Zubsolv tablets are packaged in boxes of 30 individually sealed aluminum unit dose blisters, which meet the strictest child-resistant criteria. The number of blister units dispensed to you by the pharmacy will depend on the number of tablets your healthcare provider has prescribed. It is important to remember to keep Zubsolv in a secure place away from children. If a child accidentally takes Zubsolv, it is a medical emergency and can result in death. Get emergency help right away. To access your Zubsolv tablet, start by pulling a single blister unit from the blister pack. Once separated, fold the top of the unit down at and along the dotted line. With the top still folded down, you will see a notch in the center of the line. Slowly tear down at the notch to completely open the blister unit and access the Zubsolv tablet. Never try to push the Zubsolv tablet through the foil. It could cause the tablet to break. As soon as you remove your prescribed dose of Zubsolv from the blister pack, place it directly under your tongue. If more than one tablet is required, place the tablets under your tongue at the same time, but in separate places. Do not cut, crush, or break the tablet. It should be taken whole. If your mouth is dry, you can take a sip of water beforehand, but be sure to swallow the water or spit it out, and dry your hands if they are wet before you touch the Zubsolv tablet or place it under your tongue. Allow the tablet to dissolve completely. Zubsolv typically dissolves in your mouth within 5 minutes. While Zubsolv is dissolving, do not chew or swallow, because the medicine may not work as well. Do not eat or drink anything either until Zubsolv has completely dissolved. Talking while the tablet is dissolving can also affect how well the medicine in Zubsolv works. If you are not sure about your dosing, call your healthcare provider. If you miss a dose of Zubsolv, take your medicine when you remember. If it is almost time for your next dose, skip the missed dose and take the next dose at your regular time. If you take too much Zubsolv, go to the nearest hospital emergency room right away. Important safety information. Do not take Zubsolv if you are allergic to buprenorphine or naloxone, as serious negative side effects, including anaphylactic shock, have been reported. Zubsolv can cause serious and life-threatening breathing problems. Call your healthcare provider right away or get emergency help if you feel faint, dizzy, or confused. Your breathing gets much slower than is normal for you. You feel sleepy and uncoordinated. You have blurred vision. You have slurred speech. You cannot think well or clearly, or you have slowed reflexes in breathing. In an emergency, have family members tell the emergency department staff that you are physically dependent on an opioid and are being treated with Zubsolv. Zubsolv contains buprenorphine, an opioid that can cause physical dependence with chronic use. Physical dependence is not the same as addiction. Your healthcare provider can tell you more about the difference between physical dependence and addiction. Do not stop taking Zubsolv without talking to your healthcare provider. You could become sick with uncomfortable withdrawal signs and symptoms because your body has become used to this medicine. Your healthcare provider may monitor liver function before and during treatment with Zubsolv. Keep Zubsolv in a secure place away from children. If a child accidentally takes Zubsolv, this is a medical emergency and can result in death. Get emergency help right away. The most common side effects of Zubsolv include headache, drug withdrawal syndrome, nausea, decrease in sleep, insomnia, vomiting, pain, increased sweating, swelling of the extremities, and constipation. Tell your healthcare provider about any side effect that bothers you or that does not go away. Do not switch from Zubsolv to other medicines that contain buprenorphine without talking with your healthcare provider. The amount of buprenorphine in a dose of Zubsolv is not the same as the amount of buprenorphine in other medicines that contain buprenorphine. Your healthcare provider will prescribe a starting dose of buprenorphine that may be different than other buprenorphine-containing medicines you may have been taking. Zubsolv is not for occasional or as-needed use. An overdose and even death can happen if you take benzodiazepines benzodiazepines, sedatives, tranquilizers, or alcohol while using zubsolv. Ask your healthcare provider what you should do if you are taking one of these. You should not drink alcohol while taking zubsolv, as this can lead to loss of consciousness or even death. Do not inject, shoot up zubsolv. Injecting zubsolv may cause life-threatening infections and other serious health problems. Injecting zubsolv may cause serious withdrawal symptoms such as pain, cramps, vomiting, diarrhea, anxiety, sleep problems, and cravings. Before taking zubsolv, tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Before taking zubsolv, tell your healthcare provider if you are pregnant or plan to become pregnant. If you take zubsolv while pregnant, your baby may have signs of withdrawal at birth, and that withdrawal is treatable. Talk to your healthcare provider if you are pregnant or plan to become pregnant. Before taking zubsolv, tell your healthcare provider if you are breastfeeding or plan to breastfeed. Zubsolv can pass into your breast milk and may harm your baby. Talk to your healthcare provider about the best way to feed your baby if you take zubsolv. Monitor your baby for increased sleepiness and breathing problems. Do not drive, operate heavy machinery, or perform any other dangerous activities until you know how zubsolv affects you. Buprenorphine can cause drowsiness and slow reaction times. This may happen more often in the first few weeks of treatment when your dose is being changed, but can also happen if you drink alcohol or take other sedative drugs when you take zubsolv. Zubsolv is a controlled substance, C3, because it contains buprenorphine, which can be a target for people who abuse prescription medicines or street drugs. Keep your zubsolv in a safe place to protect it from theft. Never give your zubsolv to anyone else. It can cause death or harm them. Selling or giving away this medicine is against the law. This is not a complete list of negative side effects associated with zubsolv. For a complete list, please see full prescribing information at www.zubsolv.com. To report negative side effects associated with taking zubsolv, please call 1-888-982-7658. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. For more information about zubsolv, buprenorphine, and naloxone sublingual tablet C3, please see the respective full prescribing information and medication guide at www.zubsolv.com or speak with your healthcare provider.
So I hope you enjoyed that video, and I hope it was educational for you. If you have any questions, you can email me at dwood.4@yahoo.com, and I'll do my best to get back to you as soon as possible. If I don't have the answers, Dr. Gresser is also available for me to consult, and he will either answer directly and or send it through me. So you will get as good of answer as I can get. I also can call Aaron from zubsolv to get any answers related to that if I don't know the answer. So feel free to please contact me. And again, I hope you enjoyed that message. Thank you.